Welcome, welcome. Thank you for coming to this talk today about heart health. We're going to get to the main topic. My name is Dr. Jeff Gelband. Before we get started, I'm going to tell you a little bit about Aligned Modern Health, a little bit about me, and then we will dig into it. Okay, at Aligned Modern Health, we are an integrative healthcare clinic. Big fan of integrative medicine, trying to get to the root of what's going on. We have four major service lines that deal with that. First one is chiropractic and physical medicine. They deal with a little bit more joint pain, musculoskeletal conditions, muscle pain, the things you would typically associate with a chiropractor or a physical therapist. Our clinical massage therapy team works hand in hand with them, delivering not only relaxing massage, but clinical therapeutic massage, dealing with some of the issues you see there, muscle soreness, tightness, headaches, a lot more. Our acupuncture team, excellent group of people. They focus a lot on stress, anxiety, depression. They do some amazing things for infertility and a lot more. They treat some of the same things the functional medicine team does, but in a very different way. And then the functional medicine and clinical nutrition team is the team I'm part of. We deal with, of course, heart health, which we're going to talk more about, but also gastrointestinal, autoimmune disorders, many different things. We work hand in hand with the clinical nutrition team. Our job is to figure out what sorts of issues are going on, try to treat those in the most conservative way possible. So we try to avoid drugs and surgery where we can. And then the clinical nutrition team gives fantastic strategies to actually address those problems with diet and lifestyle. Tell you a little bit about me. So again, I'm Dr. Jeff Gelband. This is a very old picture of me. Actually, a very similar shirt to what I'm wearing now as I see that. But I'm the Associate Director of the Functional Medicine team here at Aligned Modern Health. I got my doctorate of chiropractic at National University of Health Sciences, but I am a board-certified chiropractic internist, so there's a 3-year postdoctoral program associated with that as well. My Bachelor of Science degree in biology with a minor in chemistry from NIU, where I was lucky enough to participate in some cancer research. I'm a second lieutenant in the Illinois Air National Guard. I've served for 19 years. I'm very proud to do that. I've gone to some places, gone to Afghanistan a couple of times. And in the military, one of the things I do is I am a BLS CPR instructor, where I train and certify military members on CPR. Some of the different issues I love to treat, of course, cardiovascular conditions, digestive health, hormonal health. We treat a lot more than that. I treat a lot more than that, but those are some of the issues that I'm passionate about. But you didn't come here for that. Let's get into it. Most of you are probably very familiar with heart health, at least that it's a big deal. To give you a little bit of information that you may not have known, how big a deal it really is, from Johns Hopkins Medicine, 2,200 deaths per day in the United States are due to cardiovascular disease, averaging 1 every 40 seconds. It's a lot. Some of the issues that contribute to cardiovascular disease: 78 million adults have high blood pressure, 20 million have diabetes, another 8 million have undiagnosed diabetes, and 87 million have prediabetes. When you add that up, well over 100 million people have blood sugar related issues that are contributing to their development of cardiovascular illness. And these numbers are a few years old, so I would not be surprised if it was considerably higher now. This is a big deal. To put this frame of reference, or to put a frame of reference there for you, cardiovascular disease is the #1 killer of men and women in the United States and causes more deaths than the next few causes of death combined. It's a big deal. You've heard me say cardiovascular disease a few times, but what is cardiovascular disease? Here are some terms you may have heard and some terms that we'll be using a little bit more throughout this presentation. An arrhythmia. Very simple, just means an abnormal heart rhythm. The heart beats in a very predictable way most of the time. There are many different kinds of arrhythmias. One that you may have heard before is called like AFib or atrial fibrillation. There are many different kinds, but that's just one you might have heard. Maybe a friend or a family member was diagnosed with something like that. Atherosclerosis. This is one I want you to remember. We're going to discuss this many times throughout this presentation because it is one of the main causes of most heart disease and it is preventable with generally very simple things that you can do in your home. This is a plaque buildup in the walls of the arteries. Heart attack. This is where blood flow to a part of the heart gets blocked by that atherosclerosis we were just talking about, or a blood clot, which can be a part of that. And we're going to go into more detail on that in some future slides. If blood flow to the heart is interrupted to a large extent or completely, that part of the heart muscle begins to die. Our heart is a giant muscle, but it has different sections that are supplied by different vessels, and they can be affected differently depending on how much blockage is there in a given vessel. Heart failure sounds a lot like a heart attack, but they're actually very different. In this case, the heart hasn't died, or the parts of the heart haven't died, but it's not pumping blood as well as it should. It's trying to get that blood out there, but there's congestion, there's a backup in the system where it's not moving effectively. Heart valves, heart valve problems. The heart valves have two major functions. They open to allow blood through, and they close to prevent blood from going backward. If the heart valves aren't performing either of those two functions effectively, that's where we can get some problems associated with them. And then, of course, a stroke. Fortunately or unfortunately, there's been a lot more press around strokes as of the last several years. It's become more public knowledge that when a stroke happens, getting somebody help in a very timely fashion is incredibly important. But what a stroke is when a blood vessel that feeds the brain gets blocked, usually from a blood clot, and it starts to have issues where some of that brain starts to die, just like what we were talking about with a heart attack, just in another part of the body. Okay. But what's really happening? Atherosclerosis, what we were talking about, this is the process by which this occurs. So first, I'll go through a normal vessel repair process. You're going to see the word endothelial there. What endothelial really is this part of the vessel here, the inner lining. That's the endothelium of the vessel. When we get damage in our vessels, which happens just from us being alive, we might get kind of a little scratch inside the vessel, just like if you got a scratch on the back of your hand. Your body goes to repair that. And the way it does that is it sends clotting material similar to a scab on the back of your hand, but it sends some cholesterol there to help out as well. Once the healing has occurred, the body tries to minimize that clot. Again, just like a scab, it tries to make it a little bit smaller. It tries to remove some of the cholesterol that it laid down to help the healing process. And then it starts to grow more of that inner lining of the vessel over top of that remaining scab, and it incorporates that into the wall. It wants it to be nice and smooth, but in the process, we may get a very small amount of plaquing. That's normal. I'm going to show you a picture of that in a moment. That's a normal process. An atherosclerotic repair process, meaning a process where we're getting more plaquing. We get the same amount of damage or the same little scratch inside the vessel, perhaps. The body releases a blood clot or goes to heal that area. But if we have a lot of damage throughout our body, it might take longer to heal that. And that's part of where LDL comes in. LDL might be able to make its way there faster. And when your body senses, excuse me, I'm saying LDL, cholesterol. We'll talk about that in a little bit. When your body senses more of this damage, it starts to produce more cholesterol to heal the damage. Because of all the other damage, you're going to get increases in inflammation as well. And in addition to more cholesterol helping the healing occur, you'll get larger clots forming as well. Once the healing's happened, just the same as the damage we saw before, it's overwhelming your body's repair process to try to clean up all those clots that are around and all of that LDL. It can get overwhelmed, but it still needs to heal that inner lining of the vessel. It grows over top again, just like before, but this time there's a lot more clot and plaquing occurring inside of it. And you'll see that picture on the right there does a good job showing you a little bit of that. This picture's even a little bit better. The normal section is what we're all born with, normal, healthy vessels. That fatty streak there is what's happening during a normal repair process. It's okay to have a little bit of that streaking occurring. Everybody has that. Even the healthiest people have that. That's very normal. It's just a part of our body's repair process. The problem occurs when you start to see that atheroma there form. That's excess plaquing, and that's the beginnings of it. When we get too much formation, you see that that's getting bigger over time. What happens there as that plaque continues to grow, as more and more damage can be done to that part of the vessel, it's like blowing up a balloon inside of your blood vessel. It starts to get bigger and bigger, but the walls don't get thicker. So it becomes unstable. Our body tries to help out doing that, or help out that stability, by calcifying the outside. You may have heard of that. An artery can get calcified. That's what that's talking about. It's our body trying to help us. But even with that enhanced stability, it can still become unstable as it gets bigger. It just overwhelms what the body can do. And by the time you get to where it's a plaque rupture, the two problems that can happen with that are either the plaque ruptures and then it can cause a stroke because it itself can block an artery downstream or a small vessel called a capillary, or the body can go to clot and prevent that plaque from rupturing, but then it might block an already narrowed vessel. So this is what's going on when we talk about that plaquing of the arteries. This is why prevention is so important. We can stop this before it starts. How do we determine what's going on? How would we determine what status you're at or how much plaquing is actually occurring? A standard lipid panel, which you've probably had run at your primary care doctor, or if you've seen a cardiologist, does a good job of giving us a little bit of that information, but we dig deeper. We look more closely at the ratios of cholesterol. The two I want you to focus on here are LDL and HDL. LDL gets a bad rap. It's very important, but we call it the bad cholesterol. Too much of it usually indicates that there's an inflammation or damage in the vessels. Your body needs more of it to help the repair process. L for lousy is a good way to remember it, but it's a little unfair. LDL is pretty important. And then the good cholesterol that helps clean up afterward, HDL, H for helpful. The reason we call it good, when I mentioned that it minimizes the clot, minimizes that repair process, that's what HDL does. It's the cleanup crew. After the healing's occurred, it helps minimize the clot. That's where we pay attention to not only the absolute numbers of these things, but the ratios of them. The LDL and HDL ratio. The other thing you'll see up there at the top, lipoprotein subfractions. That's a very complex way for saying how big or small most of your LDL and HDL are. Not all LDL and HDL are the same. Bigger LDL have a more, are more effective at creating healing or helping healing occur. Small LDL indicate a higher risk for cardiovascular disease, even if two different people had the same amount of LDL cholesterol in their blood. If one person had a lot of small LDL and another person had a lot of large LDL, that small LDL is a higher risk. So I won't go into too much detail about that. It does get pretty complex, but we also look at insulin and blood sugar levels. Those are important to assess your body's ability to handle blood sugar. Just like I was saying, diabetes, pre-diabetes are major contributors to heart disease. High sensitivity C-reactive protein is a marker of inflammation that has a tendency toward cardiovascular inflammation. Homocysteine is a marker that can give us a sense of some of your genetic risk for heart disease, but also of how well some of the B vitamins in your body are doing their job to reduce heart disease. Iron, super important, and disappointingly not measured often enough. Low iron causes anemia, which means your body doesn't carry enough oxygen to the tissue. That can cause heart issues. But too much iron can also cause heart issues. It increases the amount of damage done to those vessels, like those little scratches I was talking about, and to the heart itself. Very important to get that at an optimal place. And omega-3, we're going to talk a little more about those later, but these are all things we can measure, among many other things. I could talk for 2 hours on all the different things we could look at to evaluate your heart risk, LPPLA2, ox-LDL. There are lots of letters associated with these tests, but you get the point. Okay. In addition to in addition to cardiovascular specific markers, I put this study up here. Don't let it overwhelm you. I'm going to explain it in very simple detail, and please don't try to read that. We don't need anybody hitting their face into a computer or their phone. This was a study published in an American Heart Association journal. It had 893 participants. They found that the absence of 6 species of bacteria predicted a higher BMI, meaning higher weight overall, and that it altered HDL and triglycerides. Those results were consistent even when taking into account other factors. From the conclusion, our findings support the potential of therapies altering the gut microbiome to control body mass, triglycerides, and those good cholesterol. Why did I show you this? The point is, we are a research-based organization. We try to use the most up-to-date evidence, and we try to look at the whole you. It's not just about managing LDL, but really looking at the whole body and all of the different factors that might be contributing to your overall risk or your elevated cholesterol. Gut bacteria are a piece of that. So here are some of the more conventional treatments for this. We'll talk quickly about statins. Statins are a lipid lowering, meaning a cholesterol lowering medication. They're very common. It's estimated that 1 in 5 Americans have been prescribed a statin. However, there is research showing that a Mediterranean diet versus a statin was more effective at reducing the risk of cardiovascular disease, even though the statin lowered cholesterol more. It's not all about cholesterol. In a series of clinical trials, statins only increased lifespan by 5 to 27 days on average. However, with all that said, statins do benefit some people as a first-line approach. People who have familial hypercholesterolemia should take statins as a first-line approach. That's caused by a genetic defect where diet and lifestyle do not affect their cholesterol as much, and they need a statin. However, for others, statins aren't a harmless therapy, so we try to do more conservative measures first. We're going to talk a little bit later about some of the things you can do at home that you may not need help with. Some of the side effects of statins. They reduce CoQ10, an energy-inducing component in the heart that our body makes. They inhibit the synthesis of vitamin K2, something very important that helps reduce calcification of the arteries, and they reduce ketone production. Some of the risks: cancer, diabetes, cataracts, and heart failure. So they're not a harmless medication. Another study, you can see we like to look at research. This one came out pretty recently. This was a few years ago. This was a big study. If you know anything about research, 19,000 participants over 14 years, a huge study. What they were looking at, they wanted to see if baby aspirin would help prevent heart disease in elderly individuals who do not have heart disease. What did they find? It increased the risk of death by cancer. It did not reduce the risk of heart disease at all. I'm sure that we all remember the commercials from 20 years ago. Bayer really loved these commercials. The one I remember, it's a father and a son, and they're playing basketball, and dad starts to have a heart attack, and they give him aspirin. They say, wow, he should really have been taking a baby aspirin this whole time, and look how effective that can be at preventing heart disease. Well, according to that study and the FDA and the American Heart Association, that's really not the case. Where aspirin can be effective is preventing a second heart attack or a second cardiovascular event like stroke, but there is no good evidence that it helps prevent the first. From the FDA, I'll read just a small snippet of this. The FDA has concluded that the data do not support the use of aspirin as a preventative medication by people who have never had a heart attack, stroke, or cardiovascular problems. In such people, the benefit has not been established, but risks such as dangerous bleeding into the brain or stomach are still present. From the American Heart Association, because of the risk of bleeding, aspirin therapy is not recommended if you've never had a heart attack, stroke, except for carefully selected patients. So here's the point. If your doctor has prescribed aspirin to you, you should take it. They have weighed the risks and decided that in your case, the benefits outweigh the risks. But the belief that you should just take an aspirin when you turn 50 every day for the rest of your life, that is not supported by research. That is a marketing effort by the people who make aspirin. Please do not do that. Aspirin is not a harmless medication. All right, so those are all the things you shouldn't do. Let's talk about the things you can do. You can enjoy a low-carb, low-processed food diet. Optimize vitamin D and magnesium levels. Normalize your omega-3 and omega-6 levels. Implement a healthy sleep routine. Exercise regularly and reduce stress. It's easy, right? Okay, good, we're done. No, I'm just kidding. So, but we're going to talk more about these things. How would we do these things? Well, here are some ways you can do these at home. First, restoring nutrient deficiencies, especially vitamin C, D, K2, and magnesium. Get a good multivitamin. That's not one at Walgreens. If you need help finding one, that's part of where we come in. We can guide you on the right things to take. But the more you can do with food, the better. And even though a multivitamin is important and great, you need to eat your vegetables, not fruits and vegetables. It's vegetables and fruits. Focusing on vegetable intake is not only a great way to live healthier, it's going to make you feel better. I mentioned the bacteria and the effect they can have on cholesterol. Well, that's part of why organic vegetables are important. Ignoring some of the toxic effects of some pesticides, organic vegetables have more of those good bacteria to help really fortify the digestive system. And the vegetables themselves have the prebiotics you may have heard of. They're very trendy to take powders and things like that, but it doesn't do anything compared to actually eating the food. Hydrate. You need to be drinking water. Unbelievably important. Everybody wants to drink something that tastes good. I get it. You'll see those jars up there are filled with fruit. That's a great way to increase water intake. What's your goal? Half your body weight in ounces. However, if you're drinking 30 ounces of water a day, maybe, don't just start drinking 100 ounces a day all of a sudden. It's going to be a shock to the system. You are going to be in and out of the bathroom all day. Go slowly. Try to increase by maybe 10 to 15 ounces per week until you get to your target. If you need help, you can get the large water bottles. I know one brand that I won't say that's very popular right now, but you can get any water bottle. And there are also water bottles that have small diffusers in the middle of them where you can put fruit or other things in there that help your water taste better. Try to avoid powders, but the reality is whatever gets you to drink the water, that's what we want to do. Having healthy fats, but most importantly, having healthy fats with carbohydrates to help keep blood sugar stable. Carbohydrates are those foods like pastas, cakes, or sweets. An apple, for example, a very healthy food, but it's still going to cause a small spike in blood sugar eating that apple by itself. But if you had a scoop of a healthy nut butter with it, for example, that's a healthy fat that can reduce that blood sugar spike. I have some healthy fats listed there. Nuts and seeds are a great thing you can add to pasta, for example, to add a little bit of crunch, but also to make it just all that much healthier. Optimizing vitamin D and magnesium levels. Vitamin D, I won't go too much into because there's a lot of detail about it, and it's involved in a massive number of processes in your body. But it does help regulate blood pressure. It helps keep inflammation a little bit more normalized, and it's very highly involved in the process of calcification of the vessels. So it helps keep calcium balance very normal. We want to maintain those levels at a pretty high level of 60 to 80. That's kind of optimal, what we want to see in the blood. In Chicago, it's not easy to do. There's been a little more sun over the last few days, so good luck. It was nice feeling the warmth of the sun on my face as I drove to the clinic this morning, but most people in the Chicagoland area will need to take a vitamin D supplement to really get there. Magnesium, Also very important. This one we can get a little bit through food. A lot of people have learned about magnesium over the last few years. I know there are a few popular supplements. Some of them are okay forms, but there are some that are better than others. And in addition to helping relax you, maybe reduce stress a little bit, and to relax your muscles, it also helps relax blood vessels. Remember, your blood vessels have some pretty big muscles in them that help them expand and contract. So that can actually reduce your blood pressure a little bit, having a good, healthy level of magnesium. Now, you can take a supplement, but it's also even better to get it through food. The other very important thing magnesium does is it helps the heart beat normally. So that's very good too. Almonds, cashews, avocados, you see those, that small list at the bottom of the screen. There are many more foods, but those are some great foods to focus on. Omega-3 versus omega-6s. Omega-3s are those very healthy fats like fish oil. You may have heard of them. Omega-6s are the inflammatory fats that we get from meats, for example, chicken or beef, and some less healthy vegetables like corn. Those tend to cause more inflammation in our body. Omega-3s are anti-inflammatory. I won't read through all these things, don't worry. Anti-arrhythmic, anti-thrombotic, a lot of very complicated words here, but what you should take from it is that they do help prevent the progression of cardiovascular disease, and they do reduce risk considerably. They're also very effective at reducing certain markers on a lipid panel like LDL a little bit, and another one called triglycerides. We didn't talk much about that, but basically the free-floating fats in the blood. They do a great job improving the function of our blood vessels. They're so important, and these are so easy to get through food. The best source of these are certain fatty fish. So you'll see down there salmon, sardines, anchovies. Some others, mackerel, cod. There are many good ones. The ones to avoid are tilapia and catfish. They have more omega-6s in them, so they don't do the same job that some of those other healthy fish do. But maybe you don't like fish. Well, that's where fish oil can come in. If either fish is too expensive or you just don't like it, maybe you don't cook it well or something, you can take fish oil too, and that can also be very, very helpful. Not all fish oil is made the same. You can get some omega-3s from some plant-based sources, but it's not quite as effective as the marine sources. It has a slightly different version of omega-3s in it. Still, it's better than nothing. I'd rather you take that if you are adhering to maybe a plant-based or vegan lifestyle. Excuse me. Restorative healthy sleep, very important. Sleep is where our body repairs itself. I know you've all heard this. I know you've all heard to eat your vegetables. If you're having a hard time with sleep, sometimes that's easier said than done. That's where we come in. We can help you figure out why you're having a difficult time with sleep, and we can, get to the bottom of that. However, here are some things you can do at home to try to get 7 to 9 hours of sleep. There's some research that if you're only getting 5 to 6 hours of sleep, that you're not getting enough, and it increases your risk of cardiovascular disease. Turn off your electronics at least 30 minutes before bed. Keep your bedroom dark and cool. Turn off Wi-Fi. Now, this isn't necessary for everybody, but if you are having a hard time sleeping, this is a great thing to try. Not the Wi-Fi on your phone, the Wi-Fi device in your house that sends out the Wi-Fi. There are people that have frequency sensitivities, and if you do find that that helps, there might be some additional things to help reduce the cell signal in your room, for example. That's something we would talk about in one of our visits. Develop a bedtime routine. Try to do the same things in the same order at approximately the same time each night. This helps prime your body and really let it know that, yep, it's time for bed. The more of a routine you can get around sleep, generally, the easier a time you'll have falling asleep. Avoid fluids and urinate prior to getting in bed. Of course, just trying to avoid having to get up in the night. You still might have to, but maybe you normally would wake up twice, and by reducing fluid intake, you only wake up once. That's better. You'll probably have a better night's sleep as a result. Avoid caffeine after 10 a.m. Excellent. And utilize breathing exercises. We'll talk a little bit more about that later, but that can be very helpful to help you get to sleep. Oh, one quick note. There was a study that came out about 3 weeks ago on the sleep aids that are used, like Unisom, diphenhydramine, which is like Benadryl. They actually found there's an increased risk of Alzheimer's disease. So those aren't harmless either. We do want to avoid those. And again, that's where we come in. We have a lot of great natural alternatives to those that can help you get to bed. Movement and exercise. Movement and exercise are important for everything. They influence in a positive way almost every single system in your body. They help reduce blood pressure. They help reduce weight. They reduce inflammation. They improve cognitive function, everything you can imagine. So how can you do it? Increase your steps. But how many steps? Some people say 10,000, 15,000. How many? Well, actually, again, you're going to hear me talk about studies a lot. We look at them. We like studies. We try to stay as up to date as we can on the research. There was a study that came out about 3 or 4 weeks ago. The number to aim for is 7,800. 7,800 steps maximizes the cardiovascular protection from just steps per day. Now, there are increased benefits to getting more steps outside of cardiovascular health and, of course, to more rigorous exercise, but at least 7,800 steps per day. And you see there some ways, some strategies that you can increase your number of steps pretty easily. Park further from your destination, take the stairs, and so on. Strength training, very important to help your body metabolize sugar, to help keep you strong as you get older. Again, it's not all about aerobic exercise, or sometimes called cardiovascular exercise. That is very good, but strength training has a place too in keeping a healthy individual as we get older. Stretching and yoga, excellent, especially for relaxation. On that note, let's talk about reducing stress briefly. What is stress? Stress is a normal physiological response to events that make you feel threatened. When we say stress, we're referring to distress. Stress isn't a bad thing. It's a part of our lives, and having some stress is a healthy part of your life. The problem is when your stress is all the time, your body stays in that fight or flight response and it never comes down. Even when you don't necessarily perceive that, we can measure that biochemically and see cortisol, the stress hormone, what's happening with it during the day. It should start high, that's normal, and it should come down, but maybe it doesn't come down, but you don't feel stressed. That still increases your risk for cardiovascular disease. Here are some ways that you can improve that. We talked about deep breathing earlier. My favorite version of this is called box breathing. That's where you breathe in for 4 seconds, hold the breath in for 4 seconds, breathe out for 4 seconds, hold it out for 4 seconds, and repeat that 3 or 4 times. That's a really evidence-based way. There's a lot of research supporting its use. It really does engage some of the relaxation systems in your body. If you do it before bed or when you're laying in bed, you might find by the 3rd time, you just wake up all of a sudden. You don't remember if you did the 4th one or not, but it really does help a lot. I encourage everybody to try that. Mindfulness and meditation, some incredible apps out now. Calm and Headspace are just a couple. There are many. If you've never done it, you're not sure how to do it, they both have different guided meditations, different opportunities to have something, a voice in your head, so to speak, walking you through exactly how to meditate. Can be incredible if you've never done it. Not everybody responds to medication, but absolutely worth trying for everybody. Limiting or eliminating alcohol and caffeine intake. We already talked about moving. Just get anything you can do to get moving. Keeping a journal. Putting things to paper can help take them off your mind. That's, of course, a wonderful opportunity as well. And acupuncture. If you have never tried it, I encourage everybody here to try acupuncture once. We have some of the best acupuncturists in the industry. Even if you just do it once, you will probably notice improvement effects on that first visit. Really a great opportunity to try. Okay. We have talked a lot about cardiovascular disease. It is prevalent in our culture. Like I said, the #1 killer of men and women. And unfortunately, it's very common in our culture to jump immediately to pharmaceuticals rather than addressing some of the actual root causes of it and making a healthier body. We talked about diet and nutrition, healthy sleep, regular exercise, and steps to reduce stress. We really do have the opportunity to get control of our health, and you should be able to implement at least one of the things we talked about in your life. It is about progress, not perfection. But with that said, it can be hard to do on your own. That's where we come in. We, the functional medicine team, the clinical nutrition team, the acupuncture team, we have teams of people ready to help you conquer these problems and really get a good sense of where is your health at. With that said, thank you so much for joining us, but don't leave. Got a little more to talk about. If you do have any questions, please type them in the Q&A section now. We'll go over those. I'm excited to answer some of your questions. If you have some other questions or you'd like more information about how what we do pertains to your specific problems, please give us a call. Schedule a free 15-minute consultation with any of our providers. You can reach us at 773-692-6700, or you can do that at alignedmodernhealth.com. On the bottom there, you'll see the various insurance companies that we're in network with for our various services. With that said, I would love to see you in one of our clinics soon, but let's get to the Q&A. Let me go ahead and open that up here. Okay, let me just take a sip, excuse me. Is hydroxide good to use for helping you sleep better? I'm not sure. If you want to put in there, I'm not sure what you're referring to, hydroxide. That's something I'm not familiar with. Tylenol PM. Is Tylenol PM bad? Somebody asked. No, not necessarily. Tylenol PM, it's okay to use when you need it to sleep, and that goes to speak for any medication. But what we've learned in some recent research, like I was saying with Unisom or Benadryl, that's sometimes used for sleep, it does have an increased risk of Alzheimer's disease later in life. So we do want to minimize the use of it as much as possible. That's where we get into the different things that we do. We can try to figure out, hey, instead of just using Tylenol PM for the symptom, how, or rather, what factors are there that aren't letting you fall asleep naturally? You shouldn't need Tylenol to fall asleep, excuse me, Tylenol PM to fall asleep. Great question. Is CoQ10 a helpful supplement? Another great question. Absolutely. It can be helpful for most people, just like fish oil and some other things. Not every form of CoQ10 is the same. And it's hard to say how much you'd need. Again, that's something we can measure in the blood. We can determine how much do you need. But for the most part, CoQ10 is helpful for heart health. It actually helps with skin health and some other cool things too. Very helpful if you're on a statin, though. Like I mentioned, statins reduce CoQ10. And I'm not trying to make statins evil, but often there's a better way we can do it. If you are on a statin, please do take some form of CoQ10. That is helpful. Somebody asked, what about fasting for health? What effect is there on the body? It seems popular right now. For some people, it can be helpful. However, fasting has its risks also, and it's not right for everybody. It just depends on the person. That's a question. I would not advise fasting for everybody, even though it is very popular. That's something where if you met with one of our providers, we can do some labs, we can do an evaluation, and we can determine if fasting is an appropriate strategy for you. How do you best use melatonin to assist with sleep? Specifically, what is the recommended dosage, or how long prior to sleep should you take it? Should it be taken? Okay, that's a great question. That is more of a personal question. I'll give a very brief answer, but that's something where, again, seeing somebody, your primary, seeing one of us would be a better opportunity than just taking it necessarily. To answer that a little more specifically, a starting dose is usually 3 milligrams. We try to keep it low. I don't recommend using it for very long, usually maybe a week or 2 weeks to help somebody get into a better rhythm. It can be helpful, but melatonin is not ideal. It can have effects on other neurotransmitters in the brain, and it can reduce the amount of melatonin that your body makes naturally if taken too long, and you can start to depend on it for sleep. So we don't want to take it all the time, but it's okay in a very short-term sense and for most people, but please do consult with some provider before taking it. It's not ideal for everyone. How about controlling blood pressure? Start eating more of those foods that are high in magnesium. I assume you're asking how would one control blood pressure, and certainly increasing vegetable intake, controlling body mass. Those are some excellent ways to help control blood pressure. And just like we said, get moving. If you have not exercised in a long time, see one of our providers. Come in and talk to us. We can help you determine what the most appropriate exercises are to get started with. We don't want you to get injured if you haven't done anything in a long time. And then we can progress you to a place where you can do some things that will really help reduce that blood pressure. And again, you're just going to feel better. Are there any specific exercise protocols for cardiovascular benefits? Walking, high intensity interval training, long distance running? That's an excellent question. There are some that help more than others. It does depend greatly on the individual. Here's the thing. What's the best exercise? The one you do. So yes, while there are some things that might be optimal and we'd want to tailor that for where your capability is, the reality is anything that you do will cause improvement in your overall health status, including your cardiovascular benefit. And when it comes to this, I want everybody to know, obviously, if you're in your 20s or 30s or 40s, that's a great time to get started. But even if you're in your 60s and you're thinking, well, he was talking about all that plaquing, maybe it's too late for me. Remember, when's the best time to plant a tree? 20 years ago. But when's the second best time? Today. Call us, come in to see one of our providers. We will help you with this. And somebody that goes to a question here, what about people with atherosclerosis, stopping the advancement, tracking cholesterol? Absolutely. Excuse me. There are imaging studies that can be done, like a coronary artery calcium score, to assess how much atherosclerosis might be present, how much of that plaquing is there. We can also run some blood labs like LPPLA2, a lot of letters, but those help us identify how much inflammation and how much plaquing is actually going on in the vessels right now. It's a complex topic, but yes, we have many ways to stop the advancement of that cholesterol and get you on a better track. It's not too late. With that said, that's all that we'll have time for today. If you didn't get your question answered, please do reach out to one of our clinics or the number you see there, 773-692-6700, to schedule a free consult. We look forward to seeing you soon. Have a great rest of your day.